Boosters for everyone, or rather, boosters for those people who receive Moderna or Pfizer vaccines, and that would be 8 months after your second dose of the vaccine, starting September 20th. Regarding the Johnson & Johnson vaccine, don't you guys worry, we are still waiting for more data. Remember that vaccine really didn't get rolled out until March, so it started a little bit later than the mRNA vaccines, that's Moderna and Pfizer, so we just have a little bit more to learn, okay? But don't be worried. But let me tell you, I think a statistic that I was watching the White House press briefing on the COVID task force today talking about this. And Fauci said that booster shots increase antibody titers by at least tenfold. What that means is basically that boosters really jack up the antibody levels in our body, which will help protect us further against COVID. This is really important, and this is really why it's being recommended that it's not just the immunocompromised or those with weak immune systems that gets the booster vaccine, that we will all be eligible for them, those who've received Moderna or Pfizer, at least both doses, and it's been 8 months, and it's September 20th, blah, 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 to get the mRNA vaccine. So, okay, let me just give you a few other pieces of information. I talked to you about it starting September 20th. Couple of things I should say. Oh, you're probably wondering why. And this is the thing. This is really important because all along, I've been going on TV, I've been doing segments saying, and you've been asking, when are we going to have to get boosters? When are we going to get boosters? And I said, the evidence doesn't suggest that we need boosters right now. And then literally, like the snap of a finger, like you just flip your head around twice, and it's like, aha, we need boosters right now. Well, not right now, but September 20th. So I know you're saying, well, so what's the deal? The deal is that we always have to wait for the data in situations like this. We have to wait until we get the information. And then when we get the information, yes, things can literally change on a dime. You remember face masks? Remember when we were like, no mask, no mask, no mask? And then all of a sudden we were like, wear a mask. Same thing. So that's why the abrupt about face. So don't worry about that. That's why it's happened. But the reasons why we now believe that we should be getting booster vaccines is a couple of things. Number one, we have learned that over time, the effectiveness of the vaccine against the SARS-CoV-2 virus, the virus that causes COVID, the vaccine effectiveness decreases over time, meaning the vaccine doesn't work as well as time goes on. That's not an entirely surprising concept, but one that's weighing into this decision. The other thing is that's really important to know is that the vaccine effectiveness against things that are really important to us, like hospitalization, like death, like severe illness. Remember, what I've always been saying is that these vaccines will keep you very likely from dying from COVID. Well, good news here is that it still seems like these vaccines keep us from being hospitalized, having severe illness, and dying from COVID, which is freaking awesome. That is awesome. But as I mentioned before that point, the effectiveness of the vaccine against the virus that causes COVID, the effectiveness does wane. Also, we have learned that with Delta has changed the game in so many different ways, guys. We've been talking about this. It has also changed the game with our vaccines. We now know that our vaccines are less effective because of Delta. Delta has wreaked havoc on the vaccines. They don't work as well. So those are a few things that are going into the decision to recommend a booster vaccine for all people, not just those who have weakened immune systems. Now, something you should keep in mind is, people might be wondering, well, why now? Why this? Why? And one of the things they said in this COVID task force today was they said, and I really respect this idea of getting ahead of it, right? This idea that we know we're coming into the winter season. We know that Delta is just running rampant throughout the country. We know that cases and hospitalizations are just not where we want them to be, and things are not looking great right now compared to where they were before. And basically, our scientist leaders want to get ahead of that. They want to make sure that we don't get into a situation where the vaccine not only it has decreased effectiveness against the virus causing COVID, but also stops preventing hospitalizations, severe illnesses, and deaths the way it's doing now. The idea is get ahead of it before people start becoming hospitalized more, if that were going to be the case, or becoming sicker, or maybe having higher rates of death even when vaccinated. I think that's actually a very smart strategy. And basically, if you're telling me that you want me to take a booster to make sure that my risk of hospitalization, death, and severe illness from COVID stays low, sign me up. Where's the sign-up sheet? Okay. So that's how I'm looking at this. That's how I would suggest you guys look at this as well. The last thing I need to say, though, is that this recommendation is sort of just the start of the process. Remember, the FDA has to approve this recommendation, and then the ACIP, which is a CDC committee, has to make the formal recommendation for this as well. This is the same process we've gone through for pretty much everything with the COVID vaccines, etc. So it's this sort of three-pronged process that we go through each time to make sure that all the checks and balances are met, which is what we want. So this is not effective as of now, but the recommendation is in place now. It just has to go to the FDA and the CDC. You guys know, of course, I'm going to let you know when that goes through. And remember, Johnson & Johnson folks, please do not be worried. Please don't be scared. Just understand your vaccine that you received was rolled out later than the others, which is why we have less data. So as we get data, and it's upcoming, we'll be able to make recommendations there too, guys. I really hope this is helpful. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Make sure you join my group called I Got the COVID Vaccine on Facebook, so you can hear from other people who are getting the vaccine. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. If you've not subscribed to my channel and clicked the little bell for updates, please do. Guys, I'll see you soon.